Special thanks again to all of you who have joined us. And this evening, I want to invite Dr. Sowa to come and share with us on the topic of cancer. Dr. Sowa.
Thank you, Pastor. Good night to everybody. Right, so I am Dr. Sowa, Feimatta Sowa from Sierra Leone. So I've been here for almost 3 years now. I did my internship here at the Grenada General Hospital. And afterwards, I went to SGU. I am a clinical tutor at the Anatomical Sciences Department. All right, so I will be talking a little bit about cancers. One of the major causes of death in the entire world. So I'm going to be talking about the main ones that affect the world and some specifics to Grenada, okay? So before I go ahead, I have some booklets here. So some of them I have about breast cancer, I have cervical cancer, prostate, and bowel cancer, because I'm going to be talking mainly about these 4 main ones. So I'll want, if you can just pass them around so you understand better as I go ahead and talk about each of these cancers. Right. So in general, I will be talking about early detection and prevention of cancers, right? So as we go ahead at the end, of course, if you have any questions, we have a team here. So with me, I have Dr. Thompson and Dr. Harris, right? So together, we're going to be helping you guys answer whatever questions you have towards these topics, all right? Early detection, we'll talk about, well, a little bit about prevention. We're going to talk about that, and we'll also talk about these 4 types that I have mentioned. So I'm going to go a little bit in detail of each one of them. Right. So definition of cancer. So cancer is defined as the rapid growth of a cell, right? Abnormal cell growth that's going to lead. Normally, it starts with one cell, then it starts to grow beyond the normal boundaries of the tissue. And as it grows, it's going to invade other tissues, and it's going to lead to what we call metastasis as the cancer continues to grow, right? And metastasis is what is going to cause complications that will lead to death of this patient, okay? So basically, as a definition, that's what cancer is. Right, so just little key facts about cancer. So cancer is one of the leading causes of death, right? So it has been found, according to the World Health Organization, about 8.2 million deaths have been recorded in 2012. And the major ones that have been noted, you have the lung cancer, the liver, stomach, colorectal, and breast cancers have been found to be the highest among all the others. Right, and the most frequent types of cancer differ of course, if you're talking about male and female. So there are specific ones that you find in male, there are other types that you're gonna find in female, and we'll talk a little bit about that. Right, so it's been found that about 30% of the death due to cancer is because of obesity, right? Low diet in vegetables, for example, and fruits, lack of physical activity, and tobacco smoke and alcohol use, right? So these are just some of the general risk factors of cancers. Right, so tobacco smoke only have been found to cause about 20% of the global cancer deaths, right? And globally, well, if you talk of lung cancer, they found out about 70% causing the lung cancer. Right, and cancer caused by viral infections such as, for example, your HPV virus and your hepatitis are responsible for about 20% of cancer deaths in developing countries, right? Right, so talking about the causes of cancer, what causes cancer? So basically, as I was saying, you have one cell that starts to develop, right? So that cell, as it grows, then it will start to multiply. And you're going to have a genetic defect in that cell, and it will start to multiply, and you're going to have certain external factors that are going to help come together and cause the cell to transform into a cancer type of cell. And it's going to, of course, continue to divide and form what we call a malignant tumor, or to be exact, the same as cancer or neoplasm. Right. So apart from causes, so we're going to talk about the risk factors for cancer. Right. So for risk factors, we found out that more than 30% of cancer deaths could be prevented if we can modify certain of these risk factors that I'm going to mention. Right, so risk factors, you're going to have your tobacco is one of the main risk factors. History of being overweight or obese is going to be one of the main risk factors for cancers. Unhealthy diet, lack of physical exercise, alcohol abuse, right? So these have been found to be the leading causes or the associative factors to cancer production or cancer growth. Right. So also you're going to have sexual transmitted diseases, for example, your HPV or human papilloma virus, right? That's going to lead to the development of cervical cancer, to be exact, in females. Right. And you're going to have also factors like urban pollution, use of asbestos in working conditions can also lead to the development of cancers. Right. So how can we prevent cancer in our bodies? Right. So we can do that, one, by avoiding these risk factors that I've mentioned. Right. So for example, if you're a smoker, you try to reduce or stop smoking. That's going to help a lot in reducing the development of cancers. Right. So, for example, if we talk of the HPV vaccine, you're going to, they use vaccination in children. We'll talk a little bit more about that, where you can use vaccination that will help prevent cancer in that age, because after that age, of course, you cannot stop the growth of, let's say, the HPV vaccine in the growing adult. Right. So also, if we help control occupational hazards, as I was talking about the asbestos, that's going to help us reduce the risk of cancer. And of course, reduce the exposure to sunlight can also help us prevent the development of cancer. Right. So a little bit about early detection or screening in medical terms of cancers. So I'm going to go through the 4 basic cancers that I've mentioned. So we'll talk about breast cancer, we'll talk a little bit about cervical cancer, we'll talk about colorectal cancer, a little bit about lung and prostate cancer. All right. So for breast cancer screening, normally they will use the mammogram for females that are at the age of 50 and older. So when you are 50 years old, you're supposed to do a mammogram. This is the main, that's the main way now, the main test that has been used to prevent, to help early, to detect cancers early. We're talking of breast cancer. So the mammogram is the best test that has been proven to improve the detection of breast cancer. Right? So after 50 years old, you start this mammogram, then you can repeat it every 2 to 3 years, 1 to 2 years, right? And for countries that do not have the mammogram because maybe it's too expensive or maybe the country they don't have that means yet, so you can still use the monthly examination. right? So you can still use the monthly examination for breast cancer, right? So that means females need to know that every month, right, you're supposed to self-examine their breast, okay, to find if they notice any abnormality like nodules or what you can call a seed, or change in color, change in the shape of the breast, right? So all that will, just you examine the breast every month is going to help you kind of notice if there's any abnormal growth, okay? So, of course, if you notice that, you will have to go to the doctor to prove whatever is happening, right? And then the doctor is going to cause or advise you to do more tests so you can know exactly what is happening to you, if there's anything to worry about, or how to move on from there. Right, so I had a statistics about Grenada, talking about the general statistics of cancers, the mortality profile of cancers in Grenada, right? So in males, it's been found that that's from WHO, of course, World Health Organization. I think the census was done in 2010, right? They found out that the prostate cancer in males have been one of the leading causes of death in Grenada, right? Then you're going to have, after prostate cancer, then you have the lung cancer, is second to that. In females, you're going to have, they actually put other causes first, but second to that, you're going to have the breast cancer. That's going to be the leading cause here in Grenada for death due to cancer, right? So moving on, so breast cancer, so that's how you can, that's how we normally screen for breast cancer. So the mammogram, and of course, if the mammogram is not available, then the monthly test, self-examination, or some books will, or some authors will advise like every 2 to 3 years, the doctor examine the breast, and then you will see how it goes from there, okay? So apart from that, the risk factors, general risk factors, as I mentioned, you have your alcohol abuse, you have tobacco use, right? So for cancer specifically, there is a mutant gene that we call the BRCA1 and 2, and you're going to have the P53, right? So these genes have been found to be associated with cancer growth, right? And also women that use excess hormones, for example, the oral contraceptives have been proven to be another risk factor to the growth of cancer. And the late age of first childbirth, right? So women that bear children, let's say, I don't want to say 30, maybe 35 years and above, right? So they have a risk of developing cancers. And those that do not give a breast milk at all, they are also put under this group of risk factors. They even say that when you breastfeed, it's like a protective factor for the development of cancer, okay? So I have a little note there that men should remember that they also can present with cancer. Okay, so a little bit about the histology of cancer, of breast, for example, normal breast. Okay, so you have when you talk of glands, you have exocrine glands, you have two portions. You're going to have the secretory portion and you have the excretory portion, that's normally the duct. Okay, so the secretory portion produces, for example, we're talking of breast, so in the females, you're going to produce the milk, for example. And then the duct is what is going to excrete that or lead that milk to the nipple, right? So in females, after puberty, you're going to have the development of that secretory portion because of the influence of your estrogen, right? So in males, because of the lack of estrogen, or they have very little estrogen, you're not going to have the development of that you're not going to have the development of the secretory portion. So the ductal portion is what develops in males, right? So that's why males don't actually develop breasts. Well, in certain instances they do. For example, in puberty, some adolescents do develop breasts because of the influence of estrogen and other hormones, right? Also, it's been noted in the elderly, right? They also could develop breasts, right? But normally, the males, because of the increase in the ductal portion of the gland, they don't really, and the lack of estrogen, they normally don't develop the secretory portion, right? So the question might be, why we're talking of breast cancer in males? Okay, so there are different situations. For example, there could be the development of this ductal portion that I'm talking about, right? So when they have an abnormal development of that portion, then it could develop a ductal type of cancer in males, okay? And also males that take extra hormones, for example, take estrogen or other certain types of hormones, right? They are prone to develop breast cancer. And also if you have certain genetic factor, for example, they've been found certain gene mutation that, if you talk of the Klinefelter syndrome, that's one of the people, because they talk that they have the X gene, so lead them to secrete more estrogen, and that estrogen is going to lead them to develop breasts, and most of the times it's going to lead to abnormal growth and cause breast cancer in males. So these are situations that you could develop breast cancer. So it's important in males, right? When you see an abnormal growth, when you see a change in color, you don't think it's normal, so try and see a doctor and note and let the doctor find out if there's anything abnormal growing in that breast tissue, okay? Right, so moving on to the next screening, we're going to have the screening for cervical cancer. So, talking a little bit about the risk factors, apart from the general risk factors. So here we talk about the human papilloma virus, right? So this is a sexually transmitted virus. Okay, so what happens, how do we detect, or what are the risk factors for this virus? So early first sexual intercourse can lead to the presence of this virus is one of the risk factors. Multiple sexual partners, tobacco use, right? So if you have immunosuppression, for example, in HIV patients, their immune system is not that it's not well developed, but it's like it's going down. So these people are prone to having infections and are going to be prone to the HPV virus. Right, so how do we screen for this cervical cancer? So for this, we're going to have, normally they have different methods, but the main one that they use is what everybody knows as the pap smear, right? So the pap smear, they normally do it after, they still have they don't have a general consensus because the last American, I think the last American census about this is like when the child is 18 years old, you should start doing a pap smear. But I think generally it's still about 21 years old for other countries, right? But now there's a new one coming that once you're 18, you should start doing this test. Okay, other tests that you can do, and of course after you start doing the test, you should be doing it every 2 to 3 years. Right? Normally they say till the age of 49, 2 to 3 years till you are 49. After 49, you can do it every 5 years. Right? So other tests that you can do, what they call the visual inspection with acetic acid. Right? And you can also use HPV testing for high-risk HPV types. Okay, so I didn't talk about the main types. So for the HPV, the most virulent types for development of cervical cancers have been found to be the type 16 and 18, right? So you have like more than 100 types of HPV. Normally they will cause what we call genital warts, right? Little growths that you find around the genital region. Okay, so most of these type of viruses will cause that, but the most virulent ones are the 16 and 18 that have been found to cause cervical cancer. Right, so how do we prevent the HPV virus? So as I was saying, in teenagers, normally from 9 to 13 years old, they have a vaccine that they use, they call it the HPV vaccine, right? So it will help, it's not really going to stop the HPV development, it's going to just kind of delay it, right? Because 9 to 13 years old, imagine at that time, you're actually supposed to be sexually active, but in certain parts of the world, that rule doesn't follow. Okay, so it's good if we could have this vaccine to prevent our children at that age. Right, so other ways we can prevent this is to avoid using tobacco, of course, cigarette smoke. And also we should get education about safe sexual practice, including abstinence, right? So now most people don't talk about this, but it is also included as a way of educating or safe sex practice. Right. Now, another way to prevent that will help us prevent the HPV vaccine is promotion and provision of condoms for those that have already engaged in sexual activity. Right? And they talk about the male circumcision. That's really because you have, well, if I talk, it's like talking in anatomy, right? So it's like you have a foreskin around the, what I would call the prepuce, okay? I don't really know how to say that, all right? So that normally, if you take it out, it will help prevent infections, right? So basically that's what they mean here, right? So if it's not present, then it will have less risk of infections. Right. And of course, if all this doesn't work, then we can do early detection, what we call screening. So we screen the women that have been sexually active, or of course, if you're 21 or now 18 years old, then you should start the screening process, right? Okay, so the next screening we're going to talk about is for colorectal cancer, right? So this is one of the leading causes among the cancers too. Okay, so how do we screen for this? Right, so you're going to use, well, the doctors are going to use colonoscopy at the age of 50. So male or female at the age of 50, right, you should start the screening with colonoscopy, sorry. Right, and then after that, every 10 years, you're supposed to repeat the test. That's, of course, if you have no risk factors, if you have no family with this disease, okay? So colonoscopy, sorry, and then you can use what we call the fecal occult blood test, also starting at 50 years old, and every year you're supposed to repeat this test. And if you have a risk factor, that means if you have a family member with this disease, then you're supposed to start screening like 10 years of the diagnosis of that family. For example, if I have, let's say, a grandfather that presented with the disease when he was, let's say, 40 years old, that means I should start when I'm 30 years old. All right? So there are other situations when you have family members that they have different screening. So in general, this is the rule. And of course, after you test every 10 years, then you're going to, that's for if you have a family member, then you're going to continue every 3 to 5 years. Right, so this is just routine for normal people without family members, and one of the situations of when you have a family member. Right. So the next one I'll be talking about is prostate and lung cancer. I put them together because they don't really have a definitive screening test. Okay? So for lung cancer, you can use chest X-ray, you can use CT scan, right? But those, and they don't really have like a definitive one. You have to do this to prove that you have lung cancer. The same for prostate cancer, right? So people talk about the PSA, right? But now it has been proven that the PSA is not really that helpful, because you could have prostate cancer and your PSA is very low, or you could not have prostate cancer and your PSA is very high, right? So there are other things that could lead to the abnormality in PSA. So basically you have to follow the symptoms that you present with, okay? If you have difficulty passing urine, for example, or you have blood in your urine, right? So you, of course, go to your doctor and they will find out from examination what is causing all this, okay? Right, so what are the risk factors for prostate cancer apart from the general ones? So you're gonna have the age above 50 years old, right? So that's a stoplight sign to kind of check regularly for prostate cancer. Okay, so factors for prostate cancer, right? So of course, as I said, the age above 50 is a risk factor. If you have a family history, of course, right? And the race. So normally they found out that Africans and Caribbeans or African Americans have been found to have high risk for prostate cancer development. Okay, so that's telling us that if you are 50 years and above, you should be aware that prostate cancer is frequent in our race. Right, so diet, of course, fatty foods, also they found an increase in calcium levels in your diet can also lead to prostate cancer. Right, so for lung cancer, risk factors, of course, the smoke, and working environments, asbestos, radon, certain chemicals that are going to increase the risk for prostate cancer. So in conclusion, how can the burden of cancer be reduced? So talking about all what I went through, how can we reduce cancer? Basically, helping us, well, having the knowledge about cancers, of course, right? Like this forum, learn a little bit about cancer, how it presents, and what are the stoplight signs that you're supposed to look for, right? It's going to help us reduce the burden of cancer. Also implementing evidence-based strategies for cancer prevention, all right? Like eating well, vegetables, fruit are going to help. Physical exercise, for example, stop smoking, right? So those things can help us prevent, of course, also delayed or reduced exposure to sunlight is going to also help us with the prevention of the development of cancer. And if we cannot prevent it, then we can do early screening or, well, early detection or screening, right? So you can, of course, by the ages that I've mentioned, if you're talking of, for example, prostate or prostate cancer, if you're 50 years old, you should start checking and see if there is anything to worry about, right? Right. So that's just what I had for you guys about cancers, and these were just my, so if you have, apart from the booklets that I've given you, so these booklets are really good. If you look, they have quite, they will tell you all about how you can screen for cancer, the maybe questions that you have about the screening, worries, and all that. It goes into a little bit of detail to explain to us about all this, right? So those were my references. I used the World Health Organization guidelines for cancer, and I also used the UK, part of the UK system, the NHS, to bring everything together so I can give a better talk on cancers.
Good night. Just want to ask one question. I'll make a comment first and then ask this question. After 1983 in Grenada, we observed that more younger people have been dying of cancer. The institution where you have been trained, are you knowledgeable of, and do you know of any instances where any research have gone into to see why so many younger people are dying now of cancer? Now we are told, I'll just make another comment now, we are told since the Americans came into Grenada and a lot of bombing took place, that younger people, we are now seeing more younger people dying of cancer. And I don't have the facts, I've never done any research, but I'm just saying from what I've heard. I don't know if you probably might be able to, or your team might be able to give any input on this.
Oh, well, thanks for that question.
And the various types of cancer probably might be very interesting to note as well.
Types of cancer
the different types of cancer since after 1983.
Well, I had a pie chart there, right, that gave you the most frequent cancers that you present here with in Grenada as from 2010 census. That was from World Health Organization and I think Pan American group, right? So they made that census and brought up the statistics for Grenada. So it's still for male, you have prostate cancer being the leading, right? And in females, they put others, but they didn't really specify. But second to that, you have the breast cancer as being the leading cause of death in Grenada. To talk about your first question, talking about if I know anything about why the early age, right? I actually tried to find out a little bit in regards to my institution, but right now I cannot give you I don't have any definitive research group that's actually doing that, so I cannot give you an answer to say, well, this is what is happening.
Good evening, doctor. I have a question. You talked about prostate cancer, right? Mm-hmm. Now, you recommended screening for prostate cancer. One of the ways you mentioned is a PSA. And the other way, you could actually get, a digital rectal examination. Mm-hmm. So I can tell you, as a Caribbean male, it's very difficult as a man to go to a doctor and bend over and have him check my prostate. So how would you convince me, as a Caribbean male, to go and get checked for prostate cancer?
Okay, that's a good one, I should say. Right. So. And it's a good question because we as doctors are supposed to convince the patients to go to the hospital and do whatever they have to do to make them feel better, right? Right. So talking about the digital rectal exam, as you know, well, if you have a family history of prostate cancer, then there's nothing really that's going to make you feel better, right? I would just tell you have to go to the hospital so they can, do an exam, right? Well, they're going to do your digital exam, they're going to do the PSA exam, and that's going to kind of not really narrow it down if you're going to have cancer or anything, right? But of course, it's going to give you an idea if your prostate is in good shape for up to after you're 50 years old, that you're going to continue your testing. And of course, if the doctor is supposed to tell you about other symptoms. For example, I was talking of if you have problems passing urine, if you have blood in your while you're passing urine, right? So those are alarms that should tell you, well, I need to do something about that. I don't know if that really helps. All right, so there is nothing to console you about that. As a male, 50 years old, you're supposed to go and do something for that, right?
Good night, everyone. My name is Dr. Thompson, and I'm a colleague of Dr. Sowa. Her answer is a bit more diplomatic than mine. As she said before, you can dance around the fact that, oh, this is a cancer and this is what can happen. I will straight tell you that as a male, right, starting at age even 45 and up, if you start to notice, for example, what they call the dripping, you would pass urine, and then a few minutes later you would notice that there's a dripping sensation coming, right? And so this is going to be problematic because males will, I think, are accustomed to shoot and go. And so as you get older, you're no longer shooting and go, you shoot and then drip, 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 drip. So obviously this starts to be a problem. When you start to notice the blood in the urine, this should call attention to everything. But we've had patients before who have been seeing blood for months and didn't bother to come in. Once you come in and we start to tell you that this is actual blood in your urine, you should be concerned because you weren't peeing this blood when you were young, but now that you are getting older and knowing the risk factors for cancer as you get older, especially as males, especially as black males of African descent, that should, try to push you to come in. If that doesn't push you to come in, the fact that if prostate cancer is allowed to develop, then it could spread to other areas of the body as well because of its position and different types of vessels that are located there. Other places that prostate cancers can end up in your spinal cord, the back, right? And it can also go to the brain, as well as other portions of the body, such as the chest, etc. So you can start out with one problem that starts at the bottom, which we can try to help you with, but if you don't come to get that problem checked out, it will spread to other places as well. And once cancer moves from one place to the next, then basically what we're doing is treating to keep you as comfortable as possible, rather than trying to save your life. But in the end, if all else fails, we all know that the Caribbean male is very proud of their sexual prowess. So you can go ahead and discuss that portion and how that's going to be affected, because you would have then developed this issue that if you had just went to the doctor's office, bent over, let us feel the prostate, see what's going on there, and that would have been the end of it. But then you wait months to come in, even a year, even we've seen, and we cannot do anything from that point on.
Caribbean men generally are afraid of the doctor. I mean, do as you may, most guys who drink especially drink and party and, they just are afraid of going to the doctor. I have a lot of good friends who tell you, period, until they see something or feel something taking place down there. They ain't going, they tell you one dead is a dead. So they're not going. So I think, seriously, we have to find some way of encouraging our male to, as you said, a black male, to attend the doctor. Don't wait until something happens.
Sir, the only way that's going to happen is when you speak to your friends and your friends' friends speak to your friends, et cetera, et cetera. There's only so much that two female doctors can do, and we're not even Grenadians. So when you go wherever they congregate and you tell them, or someone might say something to you in passing, I've been experiencing this and so forth and so on, you make mention. At the end of the day, everybody knows. Once cancer is no longer a complete death sentence, but with the limited resources we have here in the Caribbean, the earlier detection, the better. But if you wait for this problem to develop, then there is only just so much that can be done. And a lot of people don't have the resources to leave the island to seek treatment. Because we've seen a lot of instances where it comes in and we recommend that you get some treatment that would be off island, and finances are not there, and you will not be able to get the grant from the government that I've seen a few of the patients able to get. So word of mouth and check your own history and tell the people in your own family. Start at home first. And if you start at home, then maybe it'll spread from there.
Also, what can help, for example, what Pastor is doing here, when you have these health groups, you invite them to come so they can learn more about it so they will not be that afraid to talk to doctors, right?
Good evening, doctor. The problem that was mentioned about male afraid to go to the doctor, that's a huge problem. I mean, I have the problem too. I mean, it's just the reality of what it is. I've gotten over that because I think it's just important that you do. But it is something, and many of the male who are listening to me now and will be listening, I think we have to rethink about our health. I think to teach our young son that he need to go to the doctor. If we're saying we're afraid to go to the doctor, the young son growing up thinking that doctors is something that you go to if you're close to dying or something. Women, I guess, they go much faster than we do because I guess the mothers do go to the doctor. The question I want to ask, though, is that when you talk about cancer, do we have to think also about our eating habits and pattern that can help in this area of attracting, or if we use the word attracting, but being diagnosed with cancer early? Is there eating habits that we need to develop that would help us to prevent having cancer?
So yes, that's one of the factors we have to stress. For example, avoid eating fatty foods, right? Eat more your vegetables, your fruits. More if you're eating meat, make sure the meat is what they call lean, right? So not fried, right? So basically boiled, okay? And certain research have been found, for example, drinking certain types of water, right? Water that has been exposed to sunlight for a long time, right? So they found a chemical that normally they said that's another factor that leads to the development of cancers. But basically, talking of diet, as we talk of, for example, the same diet, you talk of hypertension and diabetes, right? So vegetables, fruits, that will help.
We get the bottled water, and sometimes we keep it for a long period of time, and then I'm guilty of it. I've learned now when you throw it away, but we keep it in the car or in the house, hot, the sun got in it, the sun beat it, and then we take it and drink it because we're thirsty. Talk to us a little bit about keeping that water in the bottle and then drinking it after a period of time.
Right, so that's what I was talking about, the chemical. They found certain chemical, I think is arsenic, right, in drinking water, right? So when you expose a bottle of water, right, they say when the sun hits the rubber, right, it kind of develops this chemical in the water, and if you drink it, it's going to help in the development of cancer, right? So that's why now they advise if you want to to carry water, it's either you put it in metallic bottles instead of rubber bottles, right? Because of that long exposure to sunlight, and that's going to lead to the development. That's a risk factor for the development of cancer. I don't know if that answers the question, Pastor?
Does this same procedure go for the water that we store in our tanks, the plastic tanks and so on? Many people have those tanks at their houses. Do you still find that same chemical in those tanks, water from those tanks? Because they are in the sun all day, 24/7.
The tanks that we talked about just now, those would be the black or green tanks. So you would have noticed that those tanks would not have they're baking in the sun, but there's no direct sunlight on them. So black colors, absorb. So it wouldn't really be into the water itself, whereas the water bottles that you carry around individually, those are clear plastic.
Okay, so we are basically speaking about water that receives direct sunlight.
Well,
in clear
there's
containers, basically.
It's another thing as well, because remember the water that we're taking from the water bottles, they would have been treated for our consumption internally, whereas with the tank water, those come from the reservoirs. They would come directly from reservoirs or
The tank water normally comes from the plant, from the water plant, so they treat it with chlorine and all this other stuff.
Yeah, so they also treat their water, but your storage of the storage of the water would be different in comparison to the water that we would drink in the clear plastic. The clear plastic bottles seem to be the issue with the BHP or BP, I forget what the name of the chemical is, but the clear plastics, water bottles that we have, that's the water bottle that they're normally talking about. But for those big, huge tanks for storage, first of all, they're colored, and second of all, the water that would be going into that, I'm unaware if it's the same chemical, but I highly doubt it.
Okay.
During the 70s or 80s, people say, that is what I heard, that there was a lot of, they had some helicopters spraying planes to spray the bananas in the 70s or 80s. And people say that could have been one of the factors for the cancer prevalent in Grenada. So I want to know the chemicals from that, from the spray to spray the bananas, if the chemical could have affected us. Also, I've heard too that the satellites they have up on the hills dealing with the telecommunication sort of, if that could be another risk factor for cancer. And then my second question is concerning prostate. Do women suffer from prostate, and how? And what are the risks and so?
All right, so let's start with the first question. All right, so talking about the chemicals, I don't really know about that, what chemicals were used, right? So they would have to do a study about the cancers that are presenting now and, well, know what chemicals were used and find if there is any relation between those two. About the satellite, I'm not really sure. I don't know if my colleagues know anything about the satellite.
We can confidently say that there have been, like Dr. Sowa had said, the cancer issue is a cell that is supposed to normally do one job, but then it starts to grow out of control and do something else completely. And there are various causes for this. One of it could be a genetic cause, so that's why we keep talking about the family. Check your family history, see if anybody in the family might have had a cancer or had a death that nobody knew anything about or could not explain what had happened. It could have a dietary cause. It could even, there are many, many causes. And we can confidently say that radiation is one of these causes. To speak directly to these towers, we cannot confidently say that they have caused an issue, but we know for sure that a cause could be, okay? A cause could be that. Obviously in today's world, everything now deals with these towers. Everything is Wi-Fi, everything is transmitted, cell phones, iPads, everything. So to have a concise study on the effects of all of these elements together and how they would affect making these changes at the cellular level, that's for another study to come about. But obviously there are a lot of changes in today's world compared to the world of our parents and grandparents, a lot of dietary changes, a lot of lifestyle changes, and a lot of technological changes. How these changes will affect us in the future is yet to be seen. But some things are definite, yeah?
All right, so about the second question, if women have prostate, right? So women have uterus, men have prostate, okay? So you would not expect to see a prostate cancer in females. So remember there is a hormone that's going to lead, right? Because males, like females, they have, that's why I was giving the explanation of how you have the mammary gland developing. You have the two portions, secretory and ductal, right? So males and females have both of these, right? So because of the influence of estrogen, the female is going to develop secretory milk production portion, also with the ductal portion. But because the males have very few or no estrogen, they don't really develop breast tissue. Okay? But talking about prostate in females, the organ, it doesn't develop in females at all. Right? So there is nothing to start off with first. Okay? Whereas in comparing it with breast, the breast is there in males too, so it could also happen. Right? So there are certain, talking about prostate, except if you have what we call hermaphrodites and things like that. But if not, in females, you're not going to develop prostate cancer. All right?
In drinking water, there are certain chemicals that are used to clean the water up. Do you know of any chemical being used that can be carcinogenic?
Yes, they found the arsenic chemical to be one of the causes or one of the risk factors that could lead to the development of cancer.
What about chlorine?
I'm not really sure about chlorine. I didn't look up about the study. And all the cancer books and sites that I've checked, I didn't see chlorine as being a specific cause for cancer.
Okay. In addition to that, we use a lot of PVC pipes in Grenada for transporting water. I know that there's a chemical called polyturine, I think it is, that is within that structure of the PVC pipe. Do you know of that? And if it can cause cancer?
Not really.
Because I've come across some studies with those two chemicals.
Across those chemicals?
Yeah.
Okay, right, but we are unaware right now about those chemicals. But of course, depending on the research and how far they've gone with it, right, it's possible. But we don't know about it right now.
Thank you.
You're welcome.
In connection with the question that Sister Madeline asked, that if female could have prostate cancer, but in the past 2 years, about 2 years ago, it had a young lady in my community. She came from the hospital, after visiting her sick grandmother, and she came home and told us that the doctor said that her grandmother had prostate cancer. So that question, when I heard she asked that question, there are people that maybe honestly believe or that, that is possible. But my question is, an enlarged prostate, does it always lead to cancer?
Sorry, can you repeat that?
An enlarged prostate, like when a prostate becomes enlarged, does it always end up being cancerous? One, and is there any reason why the prostate becomes enlarged?
So for the prostate, there are different things that can lead to enlargement of the prostate, right? You have something they call prostatitis, that's inflammation of the prostate. You have what we call the benign prostatic hyperplasia, right? So that's another thing that can lead to enlargement of the prostate. Right? But how we normally detect it is the difference, for example, is the location. Okay, so of course we know about the anatomy of the prostate, so we can tell you, well, this looks right because of the presentation. It's going to be a BPH or prostatitis, or we suspect prostate cancer. Of course, they will do other tests to rule out the prostate cancer. Right, so of course they're going to, as I was talking of the location, right, they would have, if they rule out the others, then of course they're going to do a biopsy that's going to specify if whatever is developing there is indeed a cancer or not.
Thank you, Dr. Feimatta Sowa. It is good that she shared with us about cancer, and it's so important, I think, for all of us and for those of you listening online, that we take note of what we eat, what we do, because it's all part of your health. You know, you are a believer in God, but if you don't eat properly and exercise, you get sick just the same way. You have to take care of your body, and sometimes we have the tendency to say that because we believe in God, we do not take our health seriously. And there's some people who believe, well, I could pray and I don't have to go by the doctor. Well, you're going to pray and die, because there's some things God knows you could do for yourself. He will come do for you. That's why He give doctors the talents and the gifts that He gives to them, and He placed those people there with all the equipment to help us. There are things that are impossible to get done. God step in and heal. But there are things we can do for ourselves, and therefore we should take the time and make sure we go to the doctor, at least to be able to talk to them, and especially we as men. And the question of we men, Caribbean male, it is a serious problem. We do not go to the doctor. We are afraid and fearful of the doctor, and I can't understand why we are. Because what the doctor do is try to help you. And the doctors are very nice these days, not like before. They used to put a big needle, and, you know, he's afraid of the needle and so. But there's so much treatment available. And a number of us are suffering with high blood pressure, and those things are not even that. We do not even want to take our tablets, medication that is given to us. And therefore it is important. So Dr. Sowa, thank you so much for sharing this evening on the topic of cancer.
This is my daily bread. This is my daily bread. Your very word spoken to me. You are the air I breathe, Jesus. You are the air I breathe. Oh yes, you are the air I breathe. Your holy presence living in me. You are my daily bread, God. You are my daily bread, my daily bread, Jesus. You are my daily bread. Your very word spoken to me, and I'm desperate for you. I'm desperate for you. Yes, I'm lost without you. Oh, and I'm desperate for you. I'm desperate for you. Oh yes, I am, Lord, I am. I'm lost without you. This is the